Also, remember to unmute my phone.
Welcome, Jana. Thanks for joining us. And she's the co-director of the Center on Enhancing Early Learning Outcomes, CEELO. So at this time, I'd like to hand it over to Jackie to begin our bridge webinar this afternoon.
Thank you, Peter. I'd like to welcome everyone who's attending this afternoon. We're very excited to also have CEELO, the Center on Enhancing Early Learning Outcomes, co-sponsoring this production with us. And Jana Martella, as Peter said, is the co-director. This collaboration has really resulted in a thought-provoking discussion about early learning standards and their implementation. So I'll just take a brief review of today's agenda, and then we'll follow that, hopefully soon, with the presentations, because as Peter said, we really have lots of information to share today. So after we do a brief introduction and overview of the REL and CEELO being the new content center, we're very excited to have that partnership. We're going to have Catherine Scott Little from University of North Carolina at Greensboro talk about setting the stage for implementation, and she'll talk about the national trends and issues for consideration. As Peter alluded to, Jana Martella will then, between each presenter, do a short question and answer presentation. That presentation, Catherine's presentation, will be followed by Melissa Van Dyke from the National Implementation Research Network, and she'll discuss best practices related to implementation. And our final presentation for this afternoon will be Harriet Feldlaufer and Michelle Levy from the Connecticut Department of Education, where they're going to share the successes that they've had at their particular state. And Connecticut has done a lot of work in early learning standards and development, so it'll be interesting to hear it from that particular perspective. Jana will then do a synthesis in the final Q&A, and then we'll have wrap up and next steps. So when we're looking at the bridge event goals today, our presenters have been very generous, and they'll share their expertise and knowledge. So Catherine will describe the research base and the activities the states are undertaking. Melissa will describe the best practices around implementation. Harriet and Michelle will give us the state perspective. And then all will help us respond to participants' questions. So I just want to remind you that you can feel free to use the participant chat to submit questions and to chat with one another. This is a little review of how to submit your questions. You can type them right into the participant chat. Kyle will be monitoring that, and she will actually be moving some over for presenters to respond to. In the event that she doesn't get to your question, we will also be doing a follow-up document that will provide some questions and answers from all three of our presenters. Now, we did collect more than 300 questions that were submitted during registration. So depending on the amount of time we have, that will really dictate how many that we get to answer. So we're going to begin with a poll. So we'd like people to really give us a hint of where they're from. We know that this is a national webinar, and our work is usually regionally. So we'd like people to respond to where they're from and then what their professional role is. And it looks like, SEA early childhood staff is really online with us today. And I'm trying to see where people are coming from. Illinois, District of Columbia, Massachusetts. Welcome to everybody. So we have good representation across the states and across the regions. California, Colorado. So it's nice to have those people from the western states join us. And it looks like There are people from other state agencies, school and district directors, some teachers joining us also, school or district coaches, and there are people representing nonprofits and educational consultants. Oh, and Susan has also put in the chat that some folks on our webinar today may represent or work in more than one state. So that's very interesting. It's very hard for them to respond in that particular case. So thank you, Susan, for pointing that out. Ready to move on to the next slide. And I thought Peter was going to do that, but I am. Oops. Sorry, Peter. I don't know what happened. I think it's my mouse. So we're just going to give you a little bit of background. I'm going to provide some about the Regional Educational Lab. And in general, as Peter, I think, alluded to, there are a network of 10 RELs that are funded by the United States Department of Education, specifically the Institute of Education Sciences, and our contract will run until 2017. Our main goal is to help states and districts use research and data to inform that policy and practices. Now, if you're looking for your particular educational lab, you can go to ies.ed.gov. That's an I, not an L. ies.ed.gov/NCEE/EdLabs. And you'll be able to find out by your state which lab represents your region. Our region actually is New England, the New England states, New York, Puerto Rico, and the United States Virgin Islands. And we're called the REL Northeast Islands. Our particular REL has 8 research alliances, and we represent the Early Childhood Education Research Alliance. You can see the others listed here. Our REL alliances are a little bit different from some of the others because some of the others are very state-based, and we actually work very closely as a region. Our REL alliance actually represents the New England states, New York, and we have the Virgin Islands also who are included in our REL alliance. Peter, I'm having trouble advancing that slide. I don't know why. Thank you. So here's a picture of Kyle DeMayo Cook, who's our researcher, and here's the goal of the Early Childhood Education Research Alliance. Right now, I'd like to turn it over to Jana Martella, and Jana's going to tell us a little bit about CEELO.
Thank you, Jackie, and thank you for your partnership in this web conference. It's been great. We'll talk a little bit about that in a moment. I'm not going to spend too much time going over the information that you can see on our slide, except to say that we're delighted. The Center on Enhancing Early Learning Outcomes is a new center. It's one of the content centers. There are now 7 within the U.S. Department of Education network of 22 comprehensive centers providing technical assistance to the states, in our case, of course, on early learning and early childhood education. We're partnered with 15 regional comprehensive centers, and a shout out to those folks on the call from those regions and from the states that are on the call as a result of kind of some pounding the pavement, as it were, in the airwaves today. I'd also like to really give a shout out to my partners, our partners in the CEELO. The CEELO itself is primed by the National Institute for Early Education Research, and are joined with that partnership are the Council of Chief State School Officers and the National Association of Early Childhood Specialists in State Departments of Education. We have 5 key topics that we deal with in providing technical assistance to the states, comprehensive assessment systems, and using child data to drive program and practice improvement, creating a learning continuum, improving quality along the learning continuum birth through grade 3, and elevating and empowering the early childhood learning workforce, as well as connecting the dots between the other components of the early childhood system and putting all of those pieces together to strengthen alignment and efforts across the entire system. We included the map here of the Comprehensive Center system just to kind of take a look at how it is the same map that the RELs use, of course, but you might find that the borders are not exactly contiguous. I'm really grateful for this partnership with Kyle and with Jackie, and thank them for kind of reaching out and getting this going. I think that standards and implementation, it's the perfect topic to kind of connect us. We're a TA center, and the REL is a research effort, and so it's the perfect bright line kind of down the road between where research meets practice. And I think the topic of today's webinar is the finest drawing of that line. So with that, I'll turn it back over to you, Jackie, and I'm looking forward to engaging all of you with your questions and with our speakers today.
Thank you, Jana. I'm just going to read brief biographies, and what we'll do is I'll read them all at once, and that way, once we get into the presentation, we'll just go. So our first presenter is Dr. Catherine Scott Little. She's currently an associate professor at the Department of Human Development and Family Studies at the University of North Carolina at Greensboro. Catherine has collaborated on several national studies to examine early learning standards and assessments. She has also done extensive research and published studies related to early childhood teaching preparation and professional development. Catherine completed her undergraduate degree in Child Development and Family Relations at UNC Greensboro and earned a doctorate in Human Development at the University of Maryland at College Park. Prior to joining UNC Greensboro, Catherine managed a child development program for homeless children and was deputy director of a large Head Start program in Texas. Catherine began conducting early childhood research and providing training for early childhood professionals when she joined UNC Greensboro as a SERVE staff member in 1999. She joined the HDF faculty as an assistant professor in 2003. Melissa Van Dyke is our second presenter. She's the Associate Director of National Implementation Research Network. Since beginning to work with NERN in 2005, Melissa has also worked with community and state initiatives to improve mental health, child welfare, and early childhood services systems. Her recent efforts include working with state and federal initiatives related to scaling up evidence-based practices in K-12 education, evidence-based child abuse prevention programs, early childhood home visitation, leadership development and child welfare, and broad reform efforts in early childhood systems and criminal justice systems. Before joining the NERN, Melissa worked in state government in New Mexico with families and youth and child welfare, children's mental health, and juvenile justice. Melissa is a licensed social worker and a PhD candidate. Harriet, Feldlaufer, and Melissa Levy will present together in tandem. And Harriet, for the last 26 years, has worked at the Connecticut State Department of Education in the areas of early childhood education, professional development, family involvement, and school improvement. Currently, she is serving as Chief of the Bureau of Teaching and Learning. In this capacity, she oversees preschool through grade 12 curriculum, teaching and assessment, and manages over $500 million in federal and state funds. Previous to this position, Harriet was Chief of the Bureau of Early Childhood Education. She serves as co-chair of the Early Learning Standards Work Group of the Governor's Early Childhood State Advisory Council. Currently, she is the Commissioner's designee to the Governor's Early Childhood State Advisory Council and the Commission on Children. Harriet earned her bachelor's degree in early childhood education from the University of Massachusetts at Amherst and a master's of arts degree in educational psychology from the University of Michigan. Michelle Levy is a consultant for the Connecticut Department of Education in the Bureau of Teaching and Learning. She began her career in Minneapolis, Minnesota, where she worked with preschool children with autism while she completed her undergraduate work in child development. She completed her master's degree in early childhood special education at San Francisco State University. While in California, she worked as a teacher in a variety of settings, including private preschool, a nonprofit program for young children with mental health needs, and a public school integrated preschool setting. She has lived in Connecticut for the past 8.5 years, working with the Connecticut Department of Education for the last 3 as an early childhood consultant. Her work with the department has focused on standards, curriculum, and professional development. Well, we certainly have a well-represented group of speakers this afternoon, and Catherine, I'll now turn it over to you.
Thank you so much, Jackie. I'm thrilled to be here. I think this topic is so timely for where states are as we move forward in our effort to support the use of early learning standards. And so I'm going to, in this part of the presentation, just set the stage by talking about a few issues that I think we need to think about in order to implement standards successfully. So first, let me just make sure that we're all on the same page in terms of what we're talking about. Early learning standards are documents that states have written to describe what children should know and be able to do, and at this point are relatively common in the states. All states and at least 4 territories have early learning standards for preschool-age children to define what preschool-age children should know and be able to do, and well over half the states have the same type of document, although it might not be called exactly that, for infants and toddlers. And we have had a lot of work going on in this area. States have been revising and adjusting as they go because while it was new, perhaps a decade ago, we do have some experience with the documents now. And so it's quite honestly sort of hard to keep up with who has what at this point because many states have been revising their standards. And so we thought we would take just a touch of a temperature taking here to see among our audience here, what's the status of your state's preschool or pre-K early learning standards? Let's just get a feel. Or poll might not be coming up. There we go. So take just a minute here and indicate whether your state's early learning standards are published and haven't been revised lately, published and revised recently, under revision, or maybe you're not sure. So yes, these numbers do indicate what I was saying. A lot of our states are either under revision or have revised them recently. So these documents are almost constantly a work in process. Thanks for checking in on that. So now that we've sort of gotten some practice writing these documents and revising them, sometimes 2 and 3 times, our attention is really turning to how to implement them, how to make sure that they're used in the field to guide practice. And I have to say that not only are we getting better in terms of how to write these documents,
we're also, as a field, getting better in terms of how to implement these documents. In 2002, I was part of a study where we, across the nation, asked states, do you have early learning standards? And if so, what are you doing with them? We just wanted to see at that time, because they weren't very common and it was sort of new, where people were in the states. And quite honestly, when about half the states had them at that time, and when we asked, what are you doing with them, they sort of said, well, we mailed them out, we put them on the web, and literally we hope somebody's going to use them. Fast forward another decade to where we are, and in 2012, a similar study was done to see what states were doing, and what we found a decade later was that states have indeed become more sophisticated about how they're disseminating the document. The professional development that we're providing is much more intense, and we've begun to work to embed them in different systems. So we are, as a field, evolving in terms of how we're implementing these documents. And what I want to do today is to briefly highlight 4 issues or factors that need to be considered in order to set the stage for successful implementation. So I'm going to talk just a bit about high-quality standards documents themselves, some about content alignment, a bit about embedding early learning standards in other systems, and then finally professional development. In each case, I'm going to hit the highlights, provide a few examples of how states are doing this, and give some issues for consideration. Certainly more information will be available after the session, and so for this afternoon's purpose, I'm whetting your appetite along these 4 issues, and the reason I selected them is because they're really key to implementing standards. So first, we have to have a high-quality early learning standards document. If our document isn't a good set of standards, then implementation, although it might be done effectively, won't be as effective as it would if the standards themselves were of high quality. And I think there are several things that are essential for successful implementation. One, that they are based on what we know about child development and children's learning from research, that they define developmentally appropriate and significant skills for specified ages. Second, that they're sensitive to cultural and linguistic characteristics of the children that they're going to be used with. And third, that they're aligned with other systems and other documents that the programs are already using or will be using, such as the curriculum, the assessment, and various other pieces of our early childhood system. Now, states have been doing a lot of work around our early learning standards documents and working to make sure they're high quality. A couple of examples. Recently, California went through a long process of really studying research to develop their foundations for infant toddlers and for preschoolers. And so that is an example of a state that really carefully used research to design their standards. Washington, in their most recent revision, paid a lot of attention to culture and reflecting the culture background of their state. Now, we do have some issues related to content. Quite honestly, our research is not even across domains. Some domains have more research to rely on than others. Also, we have fairly limited experience writing culturally and linguistically sensitive early learning standards. We're working on that, but we do have a ways to go, and we have a tension between stakeholder input, what our people in our state think are important, and guidance that we might receive from researchers or experts, and so we have to balance that. A second issue to think about in order to successfully implement early learning standards is alignment. And this is how the standards fit with other documents or expectations. And so there are 2 types of alignment. One is horizontal, that's within the same age group, how they fit with other documents being used, so curricula or assessments. The other is vertical alignment, how the standards line up in terms of expectations across age or grade levels. Now, we have spent some time learning how to evaluate alignment and have a couple of different approaches. One is called a matrix approach, where states often develop a crosswalk or a table to show how items are lined up. And a second one is called high complexity approach, which is a more in-depth way of looking at the alignment of content. We do have a number of states that have done each of these different types of approaches toward alignment. California is a recent example of having produced a document that shows a matrix of how their content of their standards lines up with other documents, such as the Head Start, Early Child Development and Early Learning Framework. A number of states have taken that approach, and it can be helpful to show you where things are related and where holes might be. A high complexity approach is a more sophisticated methodology that can look at alignment from different parameters. And states that are listed here have done high complexity studies to help guide their revision process, to identify areas of alignment and misalignment along different parameters. So the alignment is important for implementation because if the content of the documents is not in sync with other documents that are being used, it can be hard to implement them. But it's also very complex. The documents that we're trying to align may be structured differently, their items are worded differently or written at different levels of specificity. We also have to take into account what we know about children's learning and development, and it's not necessarily linear, so a linear approach to alignment may not be the best approach. And sometimes when we think about trying to back map, which means start at an older age and sort of work backwards to a younger age for what's expected, we don't end up with the highest quality of early learning standards for the younger ages. So it's complex and warrants a good bit of thought to ensure that we have good alignment. The third issue is embedding early learning standards in early childhood systems. A number of programs have begun to think about how our early learning standards can not be a document that sits out there by themselves, but be something that infiltrates or is put into different systems, such as our QRISs, the Quality Rating and Improvement Systems, which can include standards and requirements that they have for classroom environments or for training or for practices that teachers are supposed to implement. And we have other systems such as professional competencies, which define what's expected of teachers in terms of their knowledge. And they can require that teachers are knowledgeable of early learning standards and practices that promote children's progress on the standards. So we have several examples of states that have done this. Within the QRIS, Minnesota requires programs to use aligned curricula and assessments that line up with their early learning standards. Indiana also has specific requirements for teaching practices, lesson plans in Maryland, and the use of assessments in Ohio. These are examples of how states have promoted the use of early learning standards through their QRIS. A couple of state examples, but there are numerous ones, of states that have built their early learning standards into competencies. One from North Carolina with that's where I'm from, early childhood credential requirements, and then our neighbor Virginia also has competencies. So this is some examples of infiltrating the early learning standards into different systems. There are a number of issues with this. The first is that the early learning standards are broad, shared goals across programs, but between the early learning standards and the requirements for these systems, it is implemented across multiple agencies and that are constantly changing. So it's difficult to make sure everything's in sync. It's also a bit challenging to move beyond what can we require other than just have them on the shelf, make sure that people are aware of them, how to really develop requirements and accountability that matches the use of early learning standards is an important issue. And then finally, there's professional development that we put into place in order to make sure teachers know how to use them. And we do have pre-service in higher education settings as well as in-service professional development. And as a field, we've begun to think about both awareness, just knowing what's in them, and utilization as two aspects of professional development that must be addressed. A couple of state examples. Maine and South Carolina have had initiatives to work specifically with higher ed faculty, and then some others, although there are multiple states, that have developed in-service professional development, such as California with some DVDs that they've developed, and Kentucky with a train-the-trainer model, and Rhode Island having a number of different levels of professional development. The professional development that's required for early learning standards can be really challenging because standards require a high degree of knowledge and skill on the teacher's part in a number of different areas to implement. And so as we're designing professional development, we have to think about number of different levels and also the systems of professional development and how to provide that professional development across multiple settings and agencies. So there are a lot of advantages to having early learning standards as a common goal for what we want to see happen with children. Implementing them, however, is pretty complex, and our states are very different in their context, and it takes time and a lot of effort to develop an implementation strategy. And that, I think, is the true value of today's session, to talk about implementation science and how that can guide our efforts, and then hear some state examples. I've given, there will be a handout later that has the websites for the state examples and some additional information. And then this website that you see here provides a number of different issues to think about.
So, Catherine, thank you so much. Very thought-provoking, and there are a couple of questions that have come in. I have a question in my pocket, and that is because no fewer than 10, 12 preliminary questions that were submitted by our registrants related to the Common Core. And I know that for at least 47 states are wrestling with this alignment practice against the new standards K through 3 in language, arts, and literacy and math. So do you have advice for the states as they undergo this work of implementing the Common Core in their states and making certain that they're on track to help with child outcomes related to those standards in the earlier years, but also keeping in mind that K-3 is a part of the early learning continuum?
So yes, I do know that a number of states are working toward aligning their early learning standards with the Common Core, and that can be a fairly complicated and thought-provoking process in itself. My advice in that process is to really, the Common Core is sort of a set endpoint, if you will, that we are aligning toward with our early learning standards, but in doing that, we have to be very careful to think of alignment as not just a one-for-one match, because it is more complicated than that, and to really study and carefully think about learning trajectories and the precursor skills that lead to what is included in the Common Core. So as we're thinking about that alignment, it's certainly not just, okay, this is what the Common Core requires, so therefore we just need a little less of that. But at the preschool and certainly earlier ages, we want to rely on resources that show us from research the precursor skills that lead to what's described in the Common Core. So I highly recommend resources such as the National Research Council's book, Mathematics Learning in Early Childhood, things that can describe that continuum from, in this case, 2 years all the way through 3rd grade, so you get the full picture. And as you think about what is needed at a specific age, you're putting it within the context of research and what research says is important at that age, and then leads to, but may not look exactly like, the skills that are required in the Common Core.
Great, so thank you. I know that Kyle is looking over the questions as you guys are placing them into the participant chat. As a reminder, we will no doubt fail to get to all of your questions. So both Melissa and Catherine and Harriet and Michelle have agreed to respond to the pertinent questions after. We do have a few questions, though, that came in both in the registration and also now. A couple relating to higher education. Catherine, I know that you yourself work in an institution of higher ed. Question related to standards within certification requirements and kind of the fluency with the early learning standards, for example, and what you know about how institutions of higher ed are incorporating knowledge of the standards and use of the standards, implementation of the standards within their coursework.
I do think that implementation of early learning standards in higher ed varies from state to state and even within states from institution to institution. At one point, it was more relying on an individual faculty member and whether that faculty member happened to be knowledgeable of the standards. But I think in most states now there has been at least some outreach to higher ed faculty and institutions, and certainly as competencies are developed that refer back to the early learning standards, we see that movement even stronger. I do know that a number of faculty, including here at UNCG where I am, use the early learning standards as a textbook, often across multiple courses, and integrate requirements for using the standards into students' lesson planning process. So as they learn to lesson plan and then as they implement lesson plans in practica and student teaching. And it's particularly helpful when the in-service professional development for teachers that might be supervising students in their placements are also using those standards. And so I guess if I had to, you didn't ask for some advice, but if I were to offer it, I would say you have to think of those two things together in order for students to have a successful experience learning about early learning standards and how to implement them.
Thank you so much, Catherine. In an effort to kind of stay on track here, I want to move us to the implementation science and its relevance to this issue. I know that a number of you all are posing questions. They're very interesting. We do have an additional Q&A following each presenter and also at the very end. So again, some of these we'll put in our pockets for a little bit later toward the end of the web conference, and all pertinent questions will be addressed in some way in compilation following the web conference. So Melissa, as I mentioned, there's this bright line down the center of the road that deals with implementation, and we'd love to hear your thoughts on where standards might fit in that mix, and you can take it from there.
Sounds good. Good afternoon. It's a fun conversation for me to have been engaged with the really good, strong colleagues on the phone today. I think given the mix of participants who are joining today, I think it's worth saying that there is an implementation lens that is very valuable during this design, development, and alignment work that's going on in many states, or the review and opportunity for revision work. But probably the most relevant moment that the implementation science will kind of fit in the work that you all are engaged in is at the point that there are now standards that a state feels ready to begin to put to use. And we like to think in implementation that I think our mantra is get started and get better. There's always an opportunity to be engaged in continuous improvement as we monitor what's really working well at the level of the user, at the level of the person who we're hoping to be really embracing the use of the standards. There are a number of key findings, and like the previous speaker, I will say that this is a very high-level overview around implementation, but I will leave you with some links that you can go to at a later time. But we're going to give you the 10,000-foot flyover just so that you have a sense of when it might be helpful to you in your work to come back to the implementation science. We know some things related to the gap between good ideas and seeing them in practice. And there's several gaps that we identify from the implementation field that we see as challenges that we want to begin thinking about how do we address as we plan for and engage in change efforts. The first gap is really related to how we put new practice into place in a way that folks are able to do it as intended. So this idea of fidelity, so that we can have standards, but if the early childhood teachers aren't using them as intended or in a way that would achieve the desired outcomes, then we don't get the changes that we're interested in. So there's this issue of fidelity that we'll come back to quickly a little later. The other challenge is that we can put a change into place, have people begin to use it as intended, but the supports aren't there to sustain the change. And so whether it's the ongoing training that's whether it's the ongoing coaching that's needed, whether it's the continuation around an alignment process to ensure that the full system is embracing a new way of work, we don't see those supports in place. And so we start strong, but we fade, our changes fade away. And then the final one is this issue related to scale, that we might see pockets of change. We might see places where standards are implemented as intended to good outcome and sustained over time, but we don't see it across the board. We don't see it in every setting in which we would want to see that change. And so it really is looking to implementation science to say, what are the necessary supports to see the standards used as intended to achieve the desired outcome, to see them sustained so we have sufficient supports in our system so that those changes are sustained over time, and that we see it not just in the best centers, not just in the centers that have the most resources, but we see it across the board so that all children are benefiting from the change. One of the findings from a review of the literature that NERN did back in 2005 spoke about the types of implementation efforts that have been used in the past that aren't sufficient, that don't lead to the kind of outcomes, the kind of change we're looking at. And it's worth a quick review because it points out for us the way in which we often begin a change effort but don't follow through all the way to the end with the kind of supports that are necessary to see the change through. So here are some of the findings from the literature where change was attempted but not achieved. So one method is related to implementation by law, mandates, or regulations. So we're in many contexts right now where changes are mandated, and although that can create the conditions that allow for resources to be pulled together to create changes, we know that in and of itself, it's not going to change practice at the level of the early childhood teacher that we want to be using and guided by standards. We also know that funding or incentives alone doesn't change behavior. We know that in our systems, implementation doesn't occur unless we begin to change the functions within the supporting roles, that there will be a need for most states to go back and revisit what are the additional supports needed in their system to ensure that standards are used in a way that achieve the desired outcome. And that may mean that there are new types of positions created or positions that are converted from an old way of work that was aligned to a previous system to the new way of work that is aligned to the current system. We know that passive methods, just sending out the materials, as it was talked about earlier, just sending the standards out in the mail does not lead to new behavior. It may allow for an increased awareness. There are many things we can do related to sharing information that are a good first step to get people's attention, to help people know what's possible, to ensure people have a basic level of information. But in and of itself, we don't have any reason from the literature to believe that we get change in behavior, as in using those standards to guide practice. And then probably the finding here that is often of most concern to folks is related to that training alone, no matter how well done, even when we're using best practices, doesn't lead to change in behavior. Really, we only see about 5 to 15% change when we even use the very best practices related to training. So I'm going to switch to a next slide. Some of you may have seen these data before. This is from Joyce and Showers, who are well known in the professional development world in K-12 education. Based on their experience as well as a meta-analysis of the literature that they did, what they found is when we look at increasingly high-quality training, so when we move from theory and discussion to a demonstration of the new skill, to a demonstration of the new skill now with practice and opportunity for expert feedback, that it really wasn't until, and I'm going to focus you on those final two numbers, it wasn't until coaching was added in the classroom. So it wasn't until we began to support people's new behaviors in the context in which we were asking them to use those new skills that we saw the significant bump up, that we saw uptake in new behavior. For those of you who haven't seen this slide before, I think it can feel a bit daunting, a bit concerning, because we've definitely been very focused in this country around using training as a primary strategy to create change. And these data really tell us that we're going to need to take that next step to really understand what additional supports are needed to move people from their current practice to new practice informed by the use of standards. So this is the formula for success that is helping guide how we are thinking about an active implementation approach to change. We really know that we need something in each of those three boxes if we want to achieve socially significant outcomes. So we need to have usable, effective practices, which in the case of early learning standards, it's this idea that we need to know what we're asking people to do and say differently. It needs to be at that level of operationalized. We need to be thinking about how we're helping people translate from the standard to practice what it is that we believe if they do differently, we get those different outcomes for young children. We have young children more prepared as they move into the older grades. We know more and more about what effective implementation methods are necessary to take those usable practices and put them into a context that allows uptake by the classroom teachers, by the practitioners that we're focused on. And we also know that we're in a constant cycle of learning about the context in which this work is done and learning what additional contextual challenges need to be addressed so that we can sustain the change that, again, leads to socially significant outcomes. So there's a few implementation areas that are showing up more and more in the literature and demonstrating themselves in successful efforts that we'll talk about briefly. And then it'll be information you can come back to at a later time. Oh, the multiplication signs just were circled on your slide there to note that it's not an additive effect. It's not that if we do a little more in each of these, we get a little more outcome. It really is that unless we attend to each of these boxes, we won't achieve socially significant outcomes. We might achieve something, but not at the scale that most of us are interested. So if we think about what it takes to really achieve the desired results, so in this case it would be the finished house. If we use this as an implementation analogy, we can talk about what does it take from an implementation perspective to get us where we want to go. And these are the main things that we are learning about. If we want to change in this services to children and families, or to young children in this case, we know there has to be attention to implementation planning. And you'll hear me reference in a moment the concept of stages. The literature really tells us that implementation change efforts go through a stage process, and the extent to that our activities can be matched with the stage that we're in really positions us to be successful moving forward to achieve our desired change results. We also know that we need to be attending to the infrastructure in this process and this change that we're building to. And so that, for us, we talk about implementation drivers. These are the components in an implementation infrastructure, things like how are we assessing performance of early childhood teachers? How are we determining the necessary supports or coaching methods that are needed? What are we doing to ensure that we're getting clearer and clearer about the types of people that we're selecting into this work to support the work or to do the work? What are we learning about decision support data systems that help give us feedback for program improvement? Those would all be pieces of an implementation infrastructure. And there's a growing amount of literature related to implementation teams, the people that help support the work, that help attend to the work, both from an external perspective, which might be folks providing technical assistance through one of the TA centers, or there's also a need to really be thinking about how do we build this kind of expertise more locally, so that we have folks locally who are supporting the development of the implementation infrastructure and really helping to build that capacity within any organization that's trying to support significant change efforts. So if we think about what might happen if we didn't attend to careful implementation work, we might find ourselves thinking about how things go wrong when we don't take the time to build our infrastructure and work in stages and provide the necessary supports to the planning and the building process. So I'm going to leave you with a summary slide that just says we know we need to pay attention to the what. We know we need to have clarity around what people are saying and doing as it relates to early childhood standards in the classroom. We know that if quality matters, if it matters how well the standards are used, then we need to get quite specific in our understanding of what it looks like when it's done well, or at least well enough. We know we have to be paying attention to the how. We have to be thinking about the stage-matched work that we do. We have to be thinking about the development of an implementation infrastructure to ensure that we have a competent workforce and a set of sustainable supports to see the change through. We also, and we didn't speak to this directly, but we know that we're in a constant process of improvement, that this idea of we get started and get better that I mentioned as we began, that we will never know enough to have it all figured out as we start, but we can be very intentional in our learning as we move forward, as we think about what is working at each level of the system and what can be improved to ensure that we achieve the desired outcomes. And finally, we want to think about those supports that come from our technical assistance centers, that come within each state agencies that might be able to support, and even very locally within centers, within sites, to think about who is going to be able to support this work, whose competence needs to be developed to understand what it looks like to do high-quality implementation so we both achieve the desired outcomes and see those changes sustained over time. So I have just a summary slide that I will leave up there for just a moment that says the same things I've just been talking about. And then we're going to move to a poll question. So we're interested in asking you, what are specific challenges your state or LEA or program has experienced in implementing early learning standards? And as you'll see there, we've got some options that are aligned with some of what's been discussed earlier in today's conversation.
So I think it's an interesting outcome, Melissa, as you look at this. The largest number of respondents are highlighting that professional development is among the biggest challenges, and I think that really was a hot spot of what you have been describing. One of the, I know you have some concluding slides, but as you go to those, I'm going to kind of pose two questions together for you, and that is that your research, like our work with standards, is really a decade old, and yet we really are hearing this kind of resounding echo that implementation is really where it's at, and the noise is making its way across the country. There's still a long distance to travel kind of down that road in the same direction. Catherine asks if you've identified if there's the right cocktail of methods, a mix of implementation effort that seems to work best. It's a very complicated question, but I'll give it to you anyway.
So one, I appreciate the comment about it's been about almost 10 years now since NERN did its research, the synthesis of the literature. We're actually in the process of pulling together a next review. there's been just a tremendous amount of increase in the field of implementation science in the last decade, which is fabulous because 10 years ago when the research was being pulled together, there are definitely areas in which there were just the fewest of particularly quantitative studies to pull from. So the additional interest in and I think we would say is really related to how much we are learning from efforts to implement well-defined effective practice changes and the struggles that people have and this realization that there is something to this implementation content. As far as the cocktail, I think if I would take it back, we could say that the cocktail is in two ways. We could talk about it. And I think in some ways probably I have several slides that speak to it. One, we could talk about the cocktail really being related to this understanding of we have to have clarity around what it is we're doing and what it looks like for it to be done well or well enough to achieve the desired outcomes. We talked a little bit about what are those effective implementation methods that are related to some best practices in the field that have really emerged related to stage-matched behavior. What are we doing as we're exploring a new idea and sorting out whether it's the right idea in our context at this time for this population of concern? Once we make a decision, how are we ensuring that we're taking the time up front to do the building work, to laying the foundation, to redefining how we do certain things related to hiring practices, sometimes related to accounting practices, sometimes related to credentialing, so that we're building in a broader understanding of what it means to begin to change a system to be aligned. Because when we move into what we call initial implementation, we want to have created the conditions that make it more possible for a person being asked to do something that's going to feel uncomfortable and awkward to be fully supported especially in the front end of that change process. So those are some of the stages that are really emerging as we look at successful efforts. There's also this issue around, which I spoke to, around implementation infrastructure or the drivers. And those are really the core components. Those are really, if we were to think about that cocktail, those are the elements in a system. And those are things like that's horrible when I lose my own framework. Performance assessment, coaching, training, selection, data system that we talk about as a decision support data system, creating policies and procedures that really make it easier for our folks to make the change, and then systems intervention efforts. So those are the components that if we were to talk about a cocktail, we would want to see in place. And all of that, both supported by knowledgeable people, whether they're external or whether we build capacity internally, which we think is essential, as well as this commitment to ongoing improvement. That the best we can do is start where we are, knowing that we're committed to learning and improving really forever, because the environment's always changing, so there will always be ways for us to be getting better. So I think that's a complex answer to a complex question. We may have missed the end of or the first of your statement there.
Okay, so I've learned in the standards work actually that there are no simple questions and no simple answers, but that was, thank you, Melissa. So I want to make sure that we get to your final slides and that you're able to, I'll forward you if you want to begin kind of highlighting for us the resources that are there, and then we'll move on.
Sure. So really just a couple resources to share with you. If you go back one slide, thanks. One is that there's a second gathering of the Global Implementation Conference this summer in Washington, D.C. And for those folks that feel like implementation as a content area has a draw for you, it's a cross-sector, cross-content, fabulous gathering where folks really get together to think about how we can be improving the practice of implementation based on what we're learning through experience and from the science, as well as I don't have the link there for NERN, but if you Google the National Implementation Research Network, you can find and download the synthesis of the literature, but also the NERN website will provide you with content related to all of the elements that were provided. We're kind of very quickly reviewed today on the webinar.
So thank you very much, and we have been through our Q&A there. I think that that is a great entree to hearing from the states, and now at last the rubber really is hitting the road, and Harriet and Michelle, I'll allow you guys to take it from there.
Thanks, Jana. It's a pleasure to speak with everyone today, and I'm here with my colleague, Michelle Levy, and after listening to Catherine and Melissa, this is really, really complex work, and it does take a while. So we're going to tell you a little bit about what we've been doing regarding implementation in Connecticut. First, starting with our work on our older infant-toddler guidelines and preschool framework, and then moving later to how we're trying to broaden our reach with our new, and the ink is still wet, birth to 5 early learning standards. So our vision for actually conceptualizing all aspects of our systems building work, including standards, is all children in all settings every year. So no matter where children live, play, and learn, we want to be sure that these standards unite the many adults, parents and families and home visitors, physicians and teachers who all touch the lives of children, into a common understanding and language regarding what young, healthy, and developing children need across domains. So we expect these new standards to connect programs and services across the years into an articulated continuum of development that builds over time. Some of the work that Melissa talked about was about stage-matched implementation. And I think that perhaps characterizes where we are in Connecticut with this work. If you look at providing this common language on growth and development to all the sectors, and I just named them, and there are probably even more that aren't on the slide, in Connecticut we are at different phases with different audiences. We aren't touching everybody now. So we're going to first share some of the implementation that was done with our previous standards. Again, we had infant-toddler guidelines and then preschool standards. And we are looking at this previous implementation research as really setting us up for broadening with our new standards. And I'm going to switch over to Michelle Levy now.
So I'm going to share a little, as Harriet mentioned, we've done a fair amount of work in certain sectors on our previous sets of standards, and that's really setting the stage for implementing our new birth to 5 early learning standards. So we're going to share some of that work. Melissa mentioned the Joyce and Showers work on coaching, and we looked at that and really looked at how we were initially implementing our preschool standards and really wanted to dive deeper. So we put together a project for some of our state-funded centers, a training and coaching hybrid, which had 3 days of coaching and, 3 days of training and 5 days of coaching. They followed up with another subsequent year of 4 days of coaching. Over a period of time, we reached 137 program teams. And this professional development was really designed around implementation of the early learning standards and assessment tools based upon those. The results from that, we looked at the actual implementation of standards then. We had participants rate their own improvement where they were at the beginning of the project and where they were at the end around planning with standards, around implementing those plans within their classrooms, around observing and documenting children's progress on those standards, use of assessment information, and then also just their mental model and intentionality around standards and looking at children's skills. So as you see, the chart shows significant growth. It was statistically significant difference between the pre-assessment and the self-assessment, or the pre-assessment and the post-assessment. Excuse me. We coupled that with looking at the coaches' observations as well. We know people ratings of themselves is one great piece of information, but we had the coaches also do observations. It was interesting to note that overall, the coaches rated the skills of the participants slightly lower than they rated themselves, but it really dovetailed. They both showed significant difference over the course of this project. So this was a really valuable piece of work. We really showed success with the implementation of standards through this model. It was somewhat small scale. We had limited funding. We reached a limited number of centers. As Melissa referred to the implementation teams and building capacity, we don't have data on this, but all of the coaches and trainers who were involved in this project work in some of the regional education service centers or are independent consultants. And we've stayed and involved them in other ways, and they've continued to take this work and move it in their own sectors. So it was building capacity, and the pieces that they used in this actual project have multiplied and snowballed as well. So another piece of success in implementing our prior standards was around the Connecticut infant and toddler guidelines. The birth to 3 standards are part of that guidelines document. It articulates what children should know and be able to do. The Connecticut infant and toddler guidelines also includes a parent pullout and information about supportive environments and ways to support growth and development. It came out of the Department of Social Services in 2007. So personally, we were not in-depth involved with the implementation, but I want to make sure that we share because this important work is helping to guide our future efforts as well. In 2009, there was coaching, 2 hours of coaching with an hour and a half of training. So a little smaller scale, but they definitely included the coaching component. The piece that I think is really interesting and that they really included was the inclusion of on-site coaching with some home care providers. They reached 363 home care providers with the infant and toddler guidelines, and that's a group we've often struggled to reach with support. And so that's a success we really want to draw upon. They also translated the guidelines into Spanish, and another piece that we want to draw upon as we implement our new early learning and development standards. So those are some of the past successes that we want to draw upon, but we didn't want to limit it to what we already knew and had learned. We felt the need to learn some more. So going back to Harriet's vision of all children, all settings every year, we have learned a little about some of the home care providers and about preschool settings, but we really want to make that reach wider. So we wanted to find out and do some pre-implementation research to look at what are the needs of the other sectors we want to reach, families, the home care providers, Head Start programs, the unique needs of them and of those programs in meeting both state and federal requirements, early intervention and special education, the community groups. We have a lot of early childhood councils and community groups coming together to collectively look at the needs of children. Also physicians, the medical community that interacts so closely with families and often see some of the red flags. We've asked questions of these groups around what are the barriers to using early learning standards, how can we address those barriers, what are your needs for guidance. We also put out a survey in both English and Spanish and have over 500 responses. We're a small state, so that's a big response. We've also started to pave the way with professional development. Our early learning standards we're expecting to be out sometime in the fall to winter, and but we've already started. We wanted to continue our work on supporting the cycle of intentional teaching. We also wanted to prepare programs that were using our current standards to make the transition. Going back to what Melissa and Harriet mentioned about those matching the stages of implementation, we wanted to be very thoughtful about where people were. So we've been offering sessions telling people these standards are coming out, getting them about really basing their curriculum on learning outcomes for children in a broad way so that when the standards come out, they're primed for implementing those more specific skills that and dispositions articulated in the standards. And also then, as I mentioned, looking at the programs that have already been implementing standards and helping them to think about how they can make the transition and how the current assessment tools align and fit with this work and the transition. So this is only addressing, this PD currently is only addressing those sectors that we already felt that we had the information. So our rollout and efforts around those broader sectors will happen once we gain the information from that pre-implementation research, as we were calling it, and then we will reach out to those audiences as well. I'm going to turn it back to Harriet.
So we've been very, very intentional about making sure that certain features or factors are in place as we look at this implementation. All of our work has been cross-sector. So when we think about the birth to age 5 standards themselves, they're going to be comprehensive for ages and also domains. So we won't have families or providers who previously had to go through infant toddler guidelines and then flip to a different format for preschool curriculum framework. Now we're looking at this, the continuum of birth to age 5. We are also have tied the Head Start framework, and we've been very, very deliberate about looking at the Common Core state standards in both English language arts and mathematics at kindergarten. And so, in fact, our standards are going to be written in a way that's going to be very user-friendly for kindergarten teachers, so it's not like they're entering into a different world. We are cognizant of the developmental domains that branch out into content areas addressed in K-3, so we have plans for creating standards and language for social and emotional development, logic and reasoning, and approaches to learning standards for K-3. And we think this is going to really take us far in Connecticut for pushing up good practices and really trying to look at the work around preventing preschool fade out. And we have actually public school practitioners that are very, very excited about working with us on this work. And we have reviewed our new draft standards for cultural relevancy and appropriateness with dual language learners and special needs populations. I don't know that you can see this that well on the slide, but we can also get you a better copy. And this shows actually our visual representation of the birth to 5 early learning and development standards aligned to K-3. And so you can see all the domains of development on these multiple wheels, these interactive wheels. And you can see in the red some of the areas where there are not deliberate K-3 standards in areas, and we view that as an opportunity, not a challenge, to really push this work out. We know it's critical to embed this work into pre-service preparation. So we are in the process of developing core knowledge competencies that are aligned to the learning standards, our learning and development standards, and that also focus on the cycle of intentional teaching. So focus on the use of standards and classroom assessment. So our next steps in promoting implementation, we are now in the process of validating our standards. We have contracted with NIAC for a content validation, and that work is well underway. We have national experts that are looking at all the domains and ages. We have a question mark next to age validation. We have written a prospectus and are looking for philanthropic funds to do this work. We think it might be very, very expensive, but we think it's necessary, and it's never been done before in our country. And we are also developing supporting documents. That is documents based upon what the focus group information that we receive, and trying to match what different groups need to support growth and development. What would a document or information look like, or messaging for families that may be different for pediatricians, that may be different for home care providers, And we are also beginning to develop a white paper, a policy paper on comprehensive assessment system aligned to our new standards. And there are challenges. In fact, we've listed 3, but probably go home at night and think about 10 or 15 more. One is meeting the needs of a diverse audience, knowing that we have people that live with children every day and have different needs for this information, and we have to make it accessible in a clear language. We do not have any dedicated funding for professional development at this point. In fact, the work that Michelle talked about with the training and coaching model was using some school readiness unspent funds. So we really need to be looking for ways to support the professional development, knowing that's a big need. And I guess just that there's really no magic bullet. I mean, having well-articulated, clear, comprehensive standards will in and of themselves not change child outcomes. There is no magic bullet. And so we are thinking about all the things that Melissa talked about and Catherine talked about, and really would like to get some traction, and would love to hear what other states are doing. And here's our contact information. On the right is how you can reach Michelle and I. And on the left is many documents that are posted on our early childhood cabinet, our SAC website.
So Harriet and Michelle, thank you so much. I'm going to actually move on to the synthesis and hold some questions for you all until the final few minutes of our time together, primarily because we did receive a number of questions related to how standards and implementation can really work for special populations, for dual language learners, and for children, young children with disabilities. And so really delighted that you included and incorporated your efforts on that behalf, on those 2 topic areas. Thank you so much. And so I'll run through a very quick synthesis. You all have this in your slides. Indeed, as the question related to 10 years of research on implementation, and Catherine alluded to 10 years of work on standards, it was almost that long ago that I know one of the first standards web conferences, one of the first web conferences I was ever engaged in was with my now partner, Lori Connors-Tadros, who's the project director of the new CEELO. And so we've been kind of walking this road together, all of us, for a while, but we've made great progress, really. I have to respond to the author, the individual who posed the question about that. We have been developing processes for the implementation of early learning standards. When we did this work 10 years ago, only half of the states or so had early learning guidelines in the space of pre-kindergarten, and now those are universal throughout the country and within the territories and islands that we're engaged in, and 0 to 3 standards are kind of making their way through. We're learning a lot about alignment strategies and how to incorporate those in our daily work, and we're anchoring all of our efforts, although we've been talking about what children need to know and be able to do in this continuum. We've been anchoring our work to the other systems that are attached to the overarching work. So both the early childhood systems and the components related to health that Harriet and Michelle talked about, and family engagement, but also embedding the early learning guidelines within the professional development systems. It's sound implementation practices that Melissa was talking about that kind of drive us towards the outcomes that we all want for our young children, and doing so we have to remain true and implement with a fidelity to the research, and then sustain those outcomes, taking their the systems that are anchored by the standards to scale both across states, localities, and all of the different sectors that are serving young children. And in my view, and I think the view of folks on the call and on our speakers, it's states that are continuing to drive these lessons home. And the lessons kind of are amplified when we share definitions and when we work from the evidence and when there's purposeful planning and commitment to full implementation and a return to the improvement cycles. With that, I'm going to kind of pose a question that was raised, and I think it's a really important, don't pull the survey up. I shouldn't have gone forward actually here. I went past the question, the Q&A. So I want to bring up one of our, Nina from New York actually asked us, and I feel for you, Nina, because we've all been through various cycles, whether it's implementing the Head Start Child Outcomes standards and their revision in 2007, reviewing, developing, and then renewing, revising our early learning guidelines, and now the Common Core. So just like we don't want children engaged in busy work as a result of the standards that we're implementing, we also want to assume that states and the systems folks are not engaged in busy work around this. So that's a very complicated question. Do you have advice, Catherine, Melissa, or our state folks, Harriet and Michelle, to avoid the trappings of just busy work and make sure we're doing the important things related to standards? That's an all-encompassing question. I'll let you think about it for a minute and then pipe in with your answer while I go on mute for a second. I think it's a synthesizing question, so I'd be happy to hear from you and hope that we do.
This is Catherine. I'll say that that is a core issue in both the development and implementation of early learning standards, because these, just like all systems and most documents in our field, are in a continual process of improvement. Is how I like to think of it. And I think you heard Connecticut describing their process. I do think that in terms of thinking about how often, when, and is this busy work to be working on these again, it is good to think about is whether you're at a point where revisions really are needed, has something significant changed, like a new document such as the Common Core that you need to take a look at, or whether you can, as you're implementing what you have, be collecting lessons learned and feedback along the way and kind of storing it up, because I do think that when we do this too often, it creates confusion and difficulties in implementation, as well as a feeling of frustration of, we just did this. So I'm not sure that there's a magic answer other than it is necessary, because things are always changing and hopefully improving, and some judgment about when is the best or the right time to revise the early learning standards, and then all the other things that go with them that have to be changed. It's a systems problem. So maybe Connecticut in particular might have some thoughts on that.
Well, in Connecticut, actually, there were a couple of drivers, I think, that pushed us. Our preschool framework was pretty old. It was developed in the late 90s. And our infant-toddler guidelines were in 2007, and they were developed by different groups of people for different purposes, had very different formats, and we actually, had some concern that they weren't aligned, that we were giving, and then the Head Start framework came out, and then Connecticut adopted the Common Core state standards, which were K-12, but starting with college and career readiness and working backwards. And so for us, it was really, we had enough reasons to do this. And I think we are feeling like it's actually rejuvenated and kind of jazzed us here in Connecticut. I think we have brought more people together that hadn't been working together because we had a lot of separate documents, and working in a silo was difficult, but in a lot of ways it was just okay. So this has really pushed us to work more in a systems way. And the other thing is, until you have people that are actually working on the standards, working with them, rolling up their sleeves, looking at alignment, it's the same thing. I oversaw the adoption of Connecticut's Common Core. And it truly was, in and of itself, the adoption process was a professional learning opportunity. It almost becomes like a statewide network. And it helps people understand the standards, unwrap them, really know what they're about, and begin looking at their practice differently. So I don't think it's busy work. I actually think it promotes good practice.
Thank you. That's that's the perfect response, I think. And actually, you bring up a question that I know Catherine and I had discussed a little bit earlier in the day, and that is if states are renovating their standards. Catherine, this may go to you. It may to you as well, Melissa. That we have advised them all along to really engage multiple stakeholders in the development and revision of their standards. But the Common Core implementation process has required kind of a turbocharge or a watershed, as it were. It really has speeded up initiatives that might require a little bit of time. And so states have not, we've been hearing that states are not engaging the same group or the same array of folks in kind of the alignment strategies that they're putting in place for the Common Core. Any thoughts on that, Catherine, or advice that you might offer folks?
I do think that stakeholder involvement is very important, but at the same time, I think we're in a slightly different place than we were a decade ago, and people are comfortable in general, or more comfortable might be a way to say it, with standards, the idea of standards, and they're acquainted with the content of their early learning standards. And as you say, because of some circumstances, it may not be logistically possible to bring huge groups of stakeholders together to get this done. So I think states need to think strategically about who are the most important stakeholders to make sure we involve in this particular process, which often is not looking at the whole document, but sometimes just pieces of it. And then what stakeholder involvement is needed for implementation. Whereas we focused a lot of involvement on the content of the documents early on, and people were really uncomfortable that we even had them. Now our challenge might be more of how do we get people to use them, and maybe that is a way that stakeholders are very effectively used as we do alignments and make revisions.
That's great advice. Now I'm just looking at the clock. I know that Harriet, Michelle, and Melissa, you may have other things to add, and we will engage you following the webinar. And so this is with a final note of thanks to all of you for your presentation. We do want to honor your time, and so I'm going to hand off to Jackie to finish us off here, and thank you to Jackie and Kyle as well for the development of this webinar.
Thank you, Jana. I also would like to thank all our presenters for taking time to share their important work. Thank you, Jana, for co-moderating, and sincere thanks to Kyle DeMeo-Cook and our tech team for all their behind-the-scenes work. Before you sign off, please make sure that you go to take our participant survey. You can click on the link right here, and Peter has also provided it for you in the chat. There have been several questions about the webinar, and I'm just going to move the slide to the next one so you see our contact information. But there have been several questions about the webinar archive and what questions and answers which questions will be included in the question and answer document as a follow-up product. So the webinar will be archived shortly, and you will, as registrants, you will receive an email telling you that it's available. It will take a little longer to have the question and answer document completed, because what we usually do is we select the questions and then we send them to each of the presenters and ask them to respond. But we hope that you'll be visiting our website and be able to see not only the archive of this particular webinar, but if you were not part of our last webinar, Catherine actually talked about assessments. We had a variety of people who talked about assessments, early learning assessments, and so you might be interested in that one also. So with respect to everyone's time, I'd like to thank you for coming on board and hope you enjoyed the webinar, and thank everyone once again for their questions and their comments and their support. Thank you very much.
Thank you, Jackie and Jana. This concludes the Bridge event for today. Thanks.